Here is your stem.
Okay.
Ready?
Yes, ma'am.
Okay, so if you've read and understood considering its surgical pathology station, please tell me, after you've read the stem, what are the differential diagnoses you would consider for this patient?
This may be ulcerative colitis, Crohn's disease,
Okay,
chronic colitis, or carcinoma colon.
right. They have done colonoscopy, which shows a small lesion. I'll show
Yes.
you. Right. This could be this much. Yes, how would you describe the lesion and what investigations would you ask for, keeping this in your mind? Any
This
further
is a
investigation?
Mhm. This is a colonoscopic image
Yes,
showing a lesion
yes,
in the most likely colon and with surrounding inflamed mucosa
yes.
and a discrete lesion somewhat away from the first lesion with edematous area, surrounding area.
Okay. First, your provisional diagnosis was ulcerative colitis. Can you tell me what is ulcerative colitis? How would you differentiate it from?
It is a chronic inflammatory disease
Yes,
involving all or part of the colon,
yes.
confined to the mucosa, and often involving the rectum.
All right. Please tell me what is the pathophysiology behind ulcerative colitis?
In ulcerative colitis, um, the basic pathology is here. It is actually idiopathic,
Very
but
good.
there may be neurological, environmental, or genetic etiology.
Yes.
Treatments are involved in this APC, KRAS, and P53 gene.
All right. Okay.
When
You have,
mutations occur in this gene, in case of APC mutation, there may be loss of APC that will lead to uncontrolled proliferation of cells. And in case of KRAS mutation, which is a proton oncogene, there will be dysplasia, and in case of P53 loss, there will be further advancement of the dysplasia, and it may progress to adenocarcinoma.
okay. Right. Now, considering ulcerative colitis and comparing it with Crohn's disease, please tell me histopathologically what are the differences between these two conditions?
Histopathology in case of Crohn's disease, we can find granulomatous inflammation, non-physious granulomatous inflammation. And in case of ulcerative colitis, we can find two sepsis, cryptitis, and inflammatory cells will be there in the submucosa.
All right. And
And in case of microscopic picture, there are some differences. Like in Crohn's disease, there will be cobblestone appearance. Um, and in case of ulcerative colitis, there will be a pseudopolyp, presence of pseudopolyp.
yes,
And transmural lesions will be there in case of Crohn's disease. There will be strip lesions or patchy lesions. And in case of ulcerative colitis, there will be superficial lesions, but they will be continuous.
all right, good. Please tell me what are the risk factors which contribute to the formation of these conditions?
These factors. Uh, uh, there may be genetic predisposition.
Yes, one.
Um, there, there may be
geographic, most common
Geographic,
in Western
kanalen.
countries. Then there could even be autoimmunity. Okay. All right. Please tell me. Right. Okay. Now this patient, you've already done colonoscopy. You've come across this lesion, most likely. What treatment can you suggest this lady?
In case of diagnosing this patient as ulcerative colitis, I will first advise the conservative management, that is lifestyle modification. I will advise low residual diet for this patient, and in case of medical, I can advise medical management after consultation with the gastroenterologist, and their remaining medications. I will give medications like steroid, antibiotics.
All right. More.
Salicylic acid and immunomodulator, and
Yes.
surgical patients in selected cases. Surgical treatment in selected cases.
So what is the surgical treatment you're offering?
Surgical treatment is panproctophilectomy with end ileostomy.
Right. Okay. After this procedure, what is the surveillance follow-up that you'll follow on this patient? How frequently would you be calling this patient for surveillance follow-up?
Yearly, yearly for 5 years.
Yearly.
I don't know.
This surveillance follow-up is done after surgical treatment or before?
After surgical treatment.
Before. It is done before. Okay. Considering the family history of the patient, why surveillance follow-up is important?
For the risk of developing a carcinoma colon.
Okay, what are the lifestyle changes that you could advise the patient which will reduce the risk of colon carcinoma in this lady?
I will advise low fiber, low residual diet, high fiber diet,
Yes.
low fat intake.
Yes, and stop smoking, reduce fat intake, and limit alcohol.
Stop alcohol.
Yes. All right. Okay. Right. Since it condition has ulcerative colitis, does the patient has presence of ulcers all throughout the colon?
Sorry, one. Can you repeat this?
Yes. Since the condition is ulcerative colitis, why is it called ulcerative colitis? Does the patient presents with ulcers all throughout the colon? All throughout the gut?
Throughout the colon. All throughout the colon. And it may involve the terminal ileum also.
Okay. What is an ulcer? Can you define, please?
Ulcer, it is the lesion within the skin or mucosa due to sloughing out of surface epithelium.
Okay, before you operated on this patient, you have taken a biopsy while doing colonoscopy, and the result comes back and it shows that patient has tubular dysplasia in one part and adenocarcinoma in another part. Okay, so on which tumor staging would you classify this patient? Stage and tumor.
Duke stage.
Which Duke stage? It would be which one?
Adenocarcinoma. I will look for the level level of invasion.
Yes,
of the
I told you it shows tubular dysplasia in one part, and in another part it is adenocarcinoma in the other part. So what would be Duke? Which stage would you consider?
Stage stage B, maybe. Stage B.
Stage A.
Okay.
Okay. Why?
Ma'am, in that case, I have to know the layer of invasion. If that invades beyond the muscular scopia, then I will
Yes,
call it
but
stage
it
B.
will be, yes, it will be eroding through muscularis layer.
Eroding through muscular layer, then I will call it stage B.
Okay, if it is
Otherwise, stage A.
stage A, okay, before it was stage A, and if it is eroding through muscularis layer, then it could be stage B.
Yes, ma'am.
All right, good, very good. Right. Now, what are the complete time is finished, but since we are asking very slowly, so I want you to tell me what are the complications that can arise as effect that you have gone through and you have done pen colectomy and with and ileostomy. So what are the complications that you could expect?
In case of stoma, there will be complications regarding stoma,
Yes,
like stoma repression or prolapse of stoma, or surrounding skin irritation. And and after panprocolectomy, there may be a short bowel syndrome, malabsorption, and diarrhea that may happen.
that can. Yes. Right, very good. And there could even be possibility of uh,
Gallstone,
fistula formation between
fistula formation.
other, yes, parts of the or other organs like with the colovesicle or vaginocolic or yeah, etc. So that complication can also arise in these
Mhm.
patients. All right, very good. Thank you.